Good morning, Chairman Rokita, Ranking Member Scott, and other distinguished members of the subcommittee. Thank you for the opportunity to be here today to discuss the Department of Health and Human Services Office of Inspector General's recent reviews of the Child Care and Development Fund Program, or CCDF. My testimony will summarize our office's findings and recent reports and has three key takeaways. First, vulnerabilities exist in state standards and monitoring of child care providers that put the health and safety of some children at risk. Federal requirements mandating that states strengthen minimum health and safety requirements, including background checks, and strengthen monitoring, including unannounced site visits, would reduce those risks. Two, weaknesses in certain states' fiscal controls over obligation and liquidation activities put CCDF funds at risk of being misspent. And three, HHS has identified the CCDF program as being susceptible to significant improper payments. HHS reported substantial progress in reducing the improper payment rate for the CCDF program from 9.4% in fiscal year 2012 to 5.9% in fiscal year 2013. However, sustained attention will be needed to further reduce improper payments in this program. In fiscal year 2013, Congress appropriated $5.1 billion to CCDF, which provides financial assistance for child care for approximately 1.6 million children each month. CCDF subsidizes child care for low-income children under age 13 whose parents work or attend educational or job training programs. States are required to have health and safety standards in place for all child care providers, including those providers receiving CCDF funds. These standards must cover three areas: prevention and control of infectious disease, building and ground safety, and health and safety training. Our work has demonstrated that guidance from the Administration for Children and Families, or ACF, recommendations may not be strong enough to ensure that the necessary background screening of providers and unannounced inspections occur. We are performing health and safety reviews at a number of states. Our recent completed review of Connecticut showed that all 20 of the providers reviewed did not comply with one or more state licensing requirements to ensure the health and safety of children. An example of noncompliance included flammable items such as lighter fluid and gasoline found either in unlocked cabinets or in the outdoor play area, all accessible to children. We also reviewed each state's monitoring of licensed child care providers and reported that all states complied with the federal requirement to have health and safety requirements in place for licensed child care providers. However, states' monitoring requirements for licensed providers did not always meet ACF's recommendations for background screenings or the recommended standards for unannounced inspections. Additionally, we reviewed each state's health and safety requirements and monitoring requirements for licensed exempt child care providers. We found that a number of states did not report having any requirements for certain licensed exempt providers, and some reported that they did not have requirements in place to monitor licensed exempt providers. Other states reported limited monitoring and limited use of background checks. Our work also includes reviews of states' use of funds for targeted purposes that are 100% federally funded. Weaknesses in certain states' fiscal controls over obligating and liquidating these funds put CCDF money at risk of being misspent. To date, our audits in 4 of 7 states reviewed have identified a total of $5.8 million in targeted fund expenditures that did not comply with federal requirements over a 6-year period. Lastly, as part of our oversight activities, we are required to review HHS's annual improper payment information related to CCDF and other risk-susceptible programs to determine and report compliance with the Improper Payments Information Act as amended. In fiscal year 2013 reporting, HHS estimated that improper payments for the CCDF program totaled about $306 million, or a 5.9% error rate. This is a significant reduction from the prior year estimated improper payment error rate of 9.4% and represents much progress. Looking ahead, sustained attention by HHS will be needed to continue achieving reductions of improper payments in the CCDF program. In closing, I thank the subcommittee for its interest in our work and commitment to our shared goals, ensuring that federal CCDF dollars are used for their intended purposes of providing affordable child care to low-income families that does not sacrifice quality or safety. I would be pleased to answer your questions.